Flexors.
Where to start with the knee flexion? Hook lying? No. No.
Prone? No. Yeah.
Prone, I would go for prone if supine doesn't work.
Sideline.
Supine, right? Okay. Okay, let's start having some very flicker contraction of the hamstring. Okay, just like really a slight one. So again, as usual in stages 2 and 3, the affected leg here is bent, the less affected leg. This time, I'm gonna switch. So this one is straight, this time is bent, and I'm supporting it. Okay? I would ask her to do straight leg raising on this side. This is the less involved because last time I said we don't like the straight leg raising, only on the affected side. Okay? But straight leg raising on this side. What is that here? Straight leg raising here is hip flexion, right? And resist the hip flexion. Good. Do it. Go up. You would feel an activation of the hamstring on that side. Just a little contraction. Okay, let's do it again. The hamstring on that side will be activated. Okay. This is the first one that you can do. I couldn't observe any knee flexion, right? Didn't get any of it, but just activating the muscles. Having the patient feeling them. Then I would ask her to be on her affected side. So second one would be sideline on the affected side.
This is if you don't get a response with the first one.
No, the first one you would get a response, but just a small one, and I want to get it more now. I want to see movement now.
That's progression. Sideline.
Okay? So now what we do? Being on the affected side.
Haven't tried.
What do you think? Did you say?
Just ask them to do it.
Okay, come.
Gravity eliminated.
No, come on and do it.
Me?
Yes?
I'm not a pro. I'm learning.
Okay, it's not a problem. All right. Just think. Just think about what we said before.
I don't know. Ask her maybe flex the bottom leg. See if we can get this leg to
Yeah, it's my bottom leg that's affected.
This is the second leg? Okay, so let's see. Can you bring this leg up, push it up against my hand? Maybe we'll get a reaction like that.
We did that already in supine.
You said
I got reaction,
okay.
but I want movement now.
Bend your leg. Not losing it, buddy.
Okay, good. So, good, thank you. Now I would have the affected side, the less affected side into flexion here. So the limb is completely relaxed there, into flexion, right? Okay. I'm gonna be behind my patient. My right hand is gonna be in front of her and having the hip already flexed here. Okay. My other hand would have the calf muscles stretched. Do you remember the gastrocnemius muscle? Is it sharing any flexion?
L2.
Yes, right? So I applied some stretch here to get them fired. Right? So, a little bit back. Oh, that's it. Thank you. Okay. My patient would do it. My hand is here because they would activate the hip flexors. So the thigh would go forward. So I would prevent this, okay? And having them focusing on the knee flexion when I stretch the calf muscles. So to initiate the knee flexion, I need the gastroc activated, okay? And then at this point, ask my patient to bend the knee, the affected knee. Bend it. There you go. More, a little bit more, a little bit more. Keep going and relax. So those first few degrees are mainly by the gastric muscle, not the hamstring yet. Okay, do it again, please. Then more, and relax.
You're stretching the gastric.
I'm stretching the gastric, yes. That's to activate them. Okay, so do it again, please. Bend. Now I increase the angle a little bit, right? Okay, so repeat that again. Do it. The more the angle you got here, the more the push that you would feel from the hip flexors there. Okay, bend please. Keep going. Okay, yeah. Good. One more time. Keep going. When you reach 90 degrees, okay, that's thank you for the hamstring from this position. What if my patient cannot do it?
Workspace.
No, not here. It's gonna be very helpful for the head flexors and dorsiflexors, but not for the knee flexors. Yes, it activates the knee flexors as part of the reflex, but not really helping you to get the voluntary movement.
The Achilles pressure.
Can you do E-stim?
Can you do what?
Can you do electrical stimulation? If they cannot do it.
E-stem?
Yeah.
Why not? Yeah, E-stem is always there. You can apply it at any time. Okay, but you really want movement. I want the patient to feel. I want them to, like, even with the reflex, they feel. Not with the E-stem, like.
But if they can't move it, then how would you get them?
Yes. This is how a good therapist have to find a position to help those people.
So they're able to do this now.
No, if I said, if this doesn't work,
If that doesn't get them from.
okay, have them go home, right? Okay. So, do you remember the tonic labyrinthine prone?
We haven't taken pediatrics.
I mentioned it last in neuromuscular one. If the patient is prone lying position, the flexor's tone would be higher. Do you remember when we said that the spasticity of a muscle gonna increase with a position if the limb is against gravity? See the patient when they walk, their hands goes up, right? So what if we put the patient against gravity?
The extensors would overtake.
She would try again and she would use her hip flexors.
So that's what she did, being broke. Okay. So now, if you bend the knee like this and let go, what kind of stimulus is that?
Stretch.
A quick stretch, right? Here, this is a quick stretch facilitating those muscles, right? So I didn't get a response here. So first of all, my patient is prone lying position, so tonic labyrinthine prone, improve or increasing the flexor system. This is a quick stretch that you can do, right? But if no response.
I'm confused.
More stretch? More stretch, right? So I would have this leg out of the table. What do you guys think about the hamstring now? It is stretched at the hip, but not at the knee yet. Is it stretched at the hip now? The hamstring. The hip is flexed, so it's stretched. Okay? We'll be here, okay, supporting my patient. and let go.
Um,
Okay? That applies another quick stretch to the hamstring. Okay? So she did it protectively, she did it. Okay? So here, gonna hold this position and let go. It may fall, the first. And again, it may fall. But remember, do not allow the full extension of the knee. I don't want it. It would hurt. It would apply some stress on the posterior structures here. Okay? So when I let go, my hand is always there. Let go. Okay? Let go. My hand is always there. Okay? I don't want to hurt the structure here. Right? So this is a stretch. Okay? Now, hold it please. She can hold. And lower it down. Eccentric. Doing it again. Hold it. Lower it down. Hold it. Lower it down. Good. Great. So now bend your knee, please. Bend, bend, bend. Bend, 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 bend. Stop here. I'm going to complete the range. Okay? Do it again. Bend your knee. Bend, bend, bend. That's great. Okay? Good job. You're doing a good job here. Please go. Okay? Okay? When she's able to do it, I'm going to remove that stretch. So have her prone. Okay? Now ask her to bend the knee. But remember, if your patient is lifting the pelvis up when they bend the knee, return back to this position. So it has to be the hamstring and the gastrocnemius only. And we do the same thing. Okay? Hold. Lower down slowly. Hold. Lower down. And the last one always would be against resistance. Concentric contraction against resistance. When you do this again, if she lifts the pelvis up, I'm going to return back to the progression before. So we don't allow the pelvis to move up. When you do the manual muscle test for the hamstring, we'll always do this, right? To prevent any substitution from the hip flexors. Come on. Okay? Making sense for you now? This is the very primitive one. Nothing, like regression-wise, nothing before that.
So if you can't
If
get
your patient cannot get any of the hamstring from this patient or from this position, nothing else would be helpful. Okay? All right. So now we are going to stage 4. No. So as in the picture here, this side you can start with this side bent, okay? And then, do you remember when we did the hip flexors? I applied the resistance this way, right? This time, we're gonna slide it. Okay, bend your knee. Bend, bend, bend. Keep going, keep going. Bending the knee. Here, she's activating the hamstring now. So sliding. Okay? And you can use this. So you can use it with gravity. So if I have her like that, okay, so bend, very easy one, right? Okay, you can remove that and it becomes only the hamstring, the heel slides. Remember the heel slides of the knee replacement? That's the heel slides of the knee replacement. Okay, and again, a sliding board. And the patient is sliding his or her leg kind of like back and forth. Okay? this with even before the resistance. You can do that. Okay. In stage 4, knee flexion beyond 90 degrees in sitting. Correct. So I may have this against the patient. I'm sorry, underneath the patient foot, and they start gliding. This is with the gravity. Correct. The gravity is helping. It's an inclination. Then you take this off. Just sliding back. This only applied in stage 4. In stage 5, it should be this. That's stage 5. I can use weights here, right? Ankle weights here can be done, right? And in sitting also, the patient, before we move to standing, we need to apply some resistance, right? So again, the elastic band. So hamstring curls in sitting. Elastic band will be the best. You progress with the elastic bands as the patient's strength increases. Okay, and then you move to standing. In standing, okay, the hamstring curls in standing, you can always apply ankle weights here. The ankle weights would be good for the patient. And if you remember the exercise we did with the hip flexors, that was lifting the leg up on the steps. When they have the railings, they are safe, right? And doing this. This activates the hamstring too. But at which stage? Stage 5.